nurse today. Is it okay if I do a head-to-toe assessment on you?
Yep, go ahead.
All right. Can you tell me your name and your date of birth?
Elizabeth Trudeau, January 23rd, 2001.
All right. And do you know what year it is?
It is 2021.
All right. I'm just going to start by asking you some medical history.
Okay.
Do you have any current illnesses or diseases?
No.
Okay. Do you take any supplements or
No.
anything over the counter? Are you on any medications?
No.
Okay. Do you have any family history? Like sudden deaths or anything like that?
No.
Okay. And how often do you smoke?
Never.
Okay. And how often do you drink?
Never.
And how often do you use illicit drugs?
Never.
All right. And how often would you say you exercise?
5 days a week.
All right. When you exercise, what kind of things do you do?
Cardio.
Cardio for how long?
30 minutes.
All right. And would you consider your diet healthy?
Yep.
All right. Do you have any allergies?
None.
All right. And have you ever had any surgeries? No? All right. I'm going to go ahead and take your vitals. If I had a thermometer, I'd take your temperature and do your O2. But we're going to start with your blood pressure. Sorry. So tangled. All right. I'm going to go ahead and do a 2-step blood pressure. All right, the blood pressure is 122/86. All right. I'm just gonna go ahead and check your pulses and make sure they're symmetrical on both sides. All right. Pulses are symmetrical +2. And then I'm going to go ahead and take your pulse. All right. Your pulse was 68, respirations 18. I'm going to go ahead and start with your arms and then we'll work your way through your body. So I'm just going to look at your hands, look for any lesions. Do you have any pain?
No.
Do you have any pain anywhere?
No.
Okay. All right. Muscle tone feels symmetrical. I don't see any bumps or bruises. I'm going to check for nail clubbing. Capillary refill is within 3 seconds. That looks good. All right, your temperature feels equal bilaterally. Can you go ahead and push my hands up? All right, and push them down. Good. Just checking your resistance. Good. And then we're going to do some cerebellar tests. So if you can touch each finger to your thumb and go as fast as you can. Good. And then we're going to flip your hands on your legs. That's also checking your cerebellar function. Good. And then go ahead and shrug your shoulders up. That checks your accessory nerve. And then I think that's it. Okay. So I'm going to go ahead and move to your head. I'm just going to feel your scalp. Do you have any headaches?
No.
All right. Any head injuries? I don't feel any lumps. Just going to do a strand test. I didn't get any hair. I'm going to go ahead and feel your ears. Checking for lumps. Making sure they're symmetrical. So you have your ears pierced. Do you have any infections or complications with those?
No.
Okay. If I had an otoscope, I'd look in your ear and see a pearly gray tympanic membrane. Alright, and then I'm gonna just look at your face and make sure it's symmetrical. And go ahead, I'm gonna check your facial nerves. Go ahead and puff your cheeks out. Good, and smile. Frown. Good. Alright, I'm going to look at your eyes. And go ahead and just look straight ahead. Awesome. Just checking for, that's checking your ocular motor nerve, your abducens, and your trigeminal nerve, and your pupils are equal, react to light. And then we're going to do an accommodation. So if you can look at this pen light, and then when I tell you to, you can look at my hand. Okay? Alright, pupils are equal. I'm just going to check and see if there's any yellowing. I'm just going to pull your eyelid down and you can look up. Good, no lesions. Alright. And then, this is also going to check your facial nerves. I'm going to have you close your eyes and I'm just going to touch this Q-tip and you tell me where I'm touching.
Forehead. Cheek. Other cheek. Chin.
Alright. And then I'm just going to feel your sinuses, your frontal sinus, and your maxillary sinus. Any pain?
Mm-mm.
Alright, I'm going to go ahead and take a look up your nose. Do you have any nose trauma or nosebleeds?
No.
Alright, it's not deviated, and I don't see any polyps. I see you have a nose piercing. Any complications with that?
No.
Alright, I'm just going to look at your mouth and make sure it's symmetrical and that your lips are not dry. Alright, go ahead and open your mouth for me. Just looking at your teeth. Do you have any cavities?
Mm-mm.
Alright, go ahead and stick your tongue out. Good, that's checking cranial nerve 12, hypoglossal, and then go ahead and stick your tongue out and say ah. Good, that checks cranial nerve 9 and 10, glossopharyngeal, and your vagus nerve. I'm going to feel your lymph nodes. So you have your preauricular, your postauricular, occipital, and then your cervical chain. And go ahead and shrug your shoulders up. And your supraclavicular, none of those are palpable. So that's good. I'm going to feel your tracheal alignment. That feels good. Alright, I'm going to go ahead and go behind you. If we could turn the chair.
Yeah.
Perfect. And then you can sit with your back facing me. Awesome. I'm going to go ahead and deviate your thyroid. So if you can go ahead and swallow. Good. And swallow again. Good. Thyroid is non-palpable. I'm just going to check your neck, make sure you don't have any lesions. Looks good. I'm going to check for chest expansion that is symmetrical. Go ahead and breathe in. Good, that's symmetrical. And then I'm just going to listen to your breaths. And if you need to stop, just let me know.
Do you want my shirt off?
No, you don't have to for this one. All right. All right. Lung sounds are clear. I'm gonna go ahead and percuss the same amount of spots that I just listened to. Just go ahead and relax. Good. Tiffany heard in all 12 spots. I'm just gonna have you turn around, and then I'm gonna check for corneal reflex in your eyes. So just go ahead and look straight ahead. Good. It's direct and consensual. All right. Alright. So one last thing for your eyes. We're just going to do, it's called a 6 cardinal fields of gaze. It checks the same 3 cranial nerves that the other ones did. So go ahead and stare at my pen light, and I'm just going to move it side to side. Follow with your eyes. Good. And then I'm going to have you touch your nose to my pen light, and this is again a cerebellar function test. Good. Alright. I'm going to have you lay down, and we're just going to listen to your heart sounds, and then we'll move on from there.
This one off?
Yeah.
Lay down?
Yep. Alright. So I'm just going to check for GVD. And if I noted any, and have you set up to 45 degrees and make sure it wasn't there. Oops. Alright, I'm just gonna have you hold this so they can see. Thanks. Will you hold it with the other one so I can? Yeah, thank you. Alright. Alright, I'm gonna listen to the aortic. It's the second one down. Second intercostal space on the right. Now I'm going to listen to brewery. No brewery heard. And then on the left, second intercostal space for the pulmonic. Listening for brewery. And then the third intercostal space on the left for Erb's point. Alright. No brewery heard. And then the fourth one down for the tricuspid. And I'm listening for brewery. Okay. And last for the mitral, the fifth intercostal space. Sorry.
This way too, if you want.
Listening for buoy. All right, now I'm going to listen to your apical pulse for a minute. Apical pulse was 62. All right. So now I'm going to go ahead and listen to your abdominal sounds. I'm going to go ahead and inspect first, making sure I don't see any lumps or bumps. And I'm just going to step back here and check for symmetrical chest expansion. That looks good. I'm going to go ahead and listen to your bowel sounds. All right, listening for at least 5 vowel sounds before moving to the next quadrant, starting in the right lower. All right, vowel sounds are active. Now I'm going to go ahead and listen to your arteries, starting with the renal artery for any bruits. Going to the renal. The iliac. And the femoral. All right, no bruits heard. Now I'm just gonna go ahead and feel your femoral pulse. Making sure they're symmetrical. Good, pulses are symmetrical, +2. All right, now I'm gonna go ahead and percuss all 4 quadrants. Let me know if you have any pain, okay? All right, tympani heard in all 4 quadrants. Now I'm gonna go ahead and find the borders of your liver. All right, liver borders are found. And then I'm gonna go ahead and palpate. I'm gonna start with light and then move to deep. Let me know if you have any pain. Any pain? Okay, just a little deeper. All right, no abnormalities found. I'm gonna go ahead and move to your legs, making sure There's no edema. I don't see. I see you have a scrape on your foot. Do you know what that's from?
Oh, yeah, I just ran into something.
Okay. Checking for edema. No pitting edema. All right. And then I'm going to check for capillary refill because you have nail polish on. I'll just push on the end of your toe. All right, good. Capillary refill is within 3 seconds. I'm going to go ahead and do a sharp dull test. I'm going to take this Q-tip. You can close your eyes and just tell me whether it's sharp or dull and where, right or left thigh, ankle, where I'm poking you. So this is what sharp feels like.
Okay.
And this is dull. All right. Go ahead and tell me what it is.
Sharp right thigh. Dull left thigh. Sharp left knee. Dull right knee. Sharp lower leg. Sharp lower leg. Sharp ankle on the left. Dull ankle on the right.
All right. Go ahead and pull your feet forward a little bit.
Dull.
And on this one.
Dull.
Good. All right. All right. I'm gonna have you go ahead and sit back up in the. I'm gonna check your pulses. So go ahead and bend your leg up for me, checking for symmetry in the popliteal. All right. Pulses are symmetrical, +2. The posterior tibialis. Pulses are symmetrical, +2, and the dorsalis pedis. Good. Pulses are symmetrical, +2. All right. Go ahead and sit back up in the chair for me. All right. Just gonna listen to your carotid artery real quick. All right, I'm just gonna feel one at a time. All right, I'm gonna go ahead and listen for any bruit. If you could hold your breath for me. All right. Okay, no bruities heard. All right, I'm gonna go ahead and have you do some range of motion with your feet. So just circle your ankles around. Any pain there? Okay, we're gonna do the same resistance that we did for your hands. So go ahead and push down. All right, and up. Push my hands in. Good, and push my hands out. Awesome. All right, I'm just gonna check your patellar reflexes. All right. Good. And on this side. All right. Okay. I'm gonna have you close your eyes. All right, and go ahead and tell me what you smell.
Peanut butter.
All right. That was checking your olfactory nerve. And then I guess we forgot to have you grab shoes and socks. You can grab. I'll go grab you some shoes and socks. Okay, you put these on. Make sure the backings are on your. Yep.
Put my socks on.
And then your shoes. All right, and then we're gonna have you do a balance test. It's called a Romberg. So if you can stand with your feet apart and then your hands not touching, we're just gonna stand for 20 seconds. Make sure you have good balance. All right, we have a negative Romberg test. That means we can go ahead and test your gait. So go ahead and just walk normal up until that chair. Good, and then go ahead and turn around and we're gonna do heel to toe. All right, awesome. So after my head to toe assessment, your Braden scale is 23 out of 23. I'm just gonna make sure that it didn't miss anything and then we'll be all set.
Thank you.